Hi, my name is Dr. Thomas Rocco. I'm here from Back to Basics, CBD Medical Consultants. I'm here today with another live stream to help with people and patients understand proper dosing. That's very important. We've talked in the past a little bit about understanding dosing and with different descriptions. Essentially, there's two major descriptions with CBD, and that's hemp oil extract or hemp extract oil and CBD oil, which I like to use CBD oil because it's the end product of CBD products. There's another type of way of describing things with hemp in it. It's called hemp seed oil. There really is no CBD in any hemp seed products. It's a small amount. It's good for cooking. It's good for using for skin products, which really has good vitamin E and omega fats, but really minimal to CBD in those products. But essentially, the medications, the CBD medications used for medical issues, you want to use either a hemp extract oil product or a CBD oil product. And quickly, I'm going to go over those two descriptions, which are showing you, they're illustrating that there's CBD in the product, but it's described differently. So they're different numbers. Again, I think hemp seed, I think CBD oil milligrams is the way to describe it best because that's the end product. Hemp extract oil is the amount of the plant that's used to make that product. CBD oil milligrams is how much CBD is in the product. Most companies go by CBD oil milligrams. Some use both. Again, they're not regulated by the FDA for their description of the way to describe those medications. So the way we're going to be discussing it today is about CBD oil milligrams. So that's the first thing we want to talk about. So when we talk about issues with CBD and what they work best for, I think any type of pain can be used with CBD. Anxiety is a good issue that CBD helps, as well as sleep. Some people just take it for general wellness, and the way CBD works is through the endocannabinoid system, boosts our immune system. It works with getting inflammation lessened in your body through the neural tissues, through the endocannabinoid tissues. And that's how it works with either general wellness. It helps with feeling better with anxiety issues. It helps with the pain, with the anti-inflammatory effects, and higher doses of what you need for sleep to kind of help you feel calm and easier to sleep. So we're going to go over those things today. My background is a general surgeon. I take care of hospice patients. I also help with a pain management group that's with a neurosurgery department in the state of Rhode Island. And I'm involved with medical marijuana with the Department of Health in Rhode Island. But today we're going to talk about CBD. And with pain is where I use it the most with most of my patients. And the reason is it helps with the inflammation of their symptoms. Dosing really depends on the severity of the pain. It also depends on the weight of the patient, which is important. So for patients that are kind of medium build between, I'd say 150 to 200 pounds, usually for a mild pain, we start from about 20 to 25 milligrams. If it gets more severe, the initial dose is 40 milligrams. So the things we're talking about is this initial dosing, and you can increase it as you use it. But for me, pain, usually a CBD oil milligram dose, it should be about 20-25 milligrams to start to about 40 milligrams, medium build person, and that's your initial dose. What we do is when we talk to patients about it, we talk about dosing. We give them charts to show them where to start, how to use it, what dosing is best for them in terms of the pain severity symptoms and their weight. Now, for anxiety actually, the initial dose is a lower dose for an adult. Usually the recommendation is about 15 milligrams, 20 milligrams. And if that doesn't work, you can always repeat that dose. These are very low doses on kind of the bell-shaped curve of the CBD effect. So everything we're talking about is initial dose, starting dose, and you can increase it as you need it. The other common issue is sleep, and those you need higher doses, and the recommendation is to start at 50 milligrams. Sometimes you need to go up to about 150 milligrams, but the recommendation is start at 50 milligrams, see if that works a day or 2, 3 days. If not, then we can increase it higher from there if it's 100 milligrams. But the usual recommendation is about 50 to 150 milligram dose at night to help you with those symptoms of problems with sleep. So depending on what you need it for, depends on the dosing, and it's very different. It's not the same for everything. General wellness, I have patients that like to take it just every day, and the best way to do that is about 25 milligrams an adult to 30 milligrams. We have 30 milligram tablets is what most patients take. It's nice with a capsule because it lasts all day long. It's going to take about 45 minutes to an hour to work, but that anti-inflammatory effect, that feeling better by less inflammation, boosting your immune system is going to last all day. So for general wellness, the best thing to use is a capsule, and probably start about 30 milligrams. And I have a handful of patients that don't really have too many symptoms, but just like the effect of boosting the immune system and helping with some inflammation. How you use it is really important about your symptoms. Different ways of taking it. Again, we mainly use topicals. We use capsules, and we use tinctures. And depending on your symptoms, depends on how you should use them. I have a simple chart here. It might be hard to see, but we send these to patients. Kind of the effect of different ways of using it depends on your symptoms. The topical should work on contact, and it might last for about an hour or two. But this right here, this chart right here, these two different curves. The blue curve is more like a capsule. It takes some time to work. It's going to last most of the day, and eventually the effect will end in about 8 to 10 hours. The green graph is more like a tincture. The effect's going to happen in about 5 to 15 minutes. It's going to be a stronger effect as compared to the capsule at the same dose, but the effect's only going to last for about 2 to 3 to 4 hours. So this graph really tells you about which type of medication to take in terms of capsule, topical, tincture, as with your symptoms. Now, if you're somebody who has need for quick relief like migraines, headaches, anxiety, acute pain issues, those would be best taken care of with using a tincture, because the effect will be in about 5 to 15 minutes, and then the full effect is going to be about 2 to 3 hours. With the tincture, if the effect isn't where you want to be, you can always repeat it in 15 minutes, because that's when you kind of get the highest potential of that CBD oil. With capsules, I think it's better for somebody who's either anxious all the time, somebody who is always in pain, wakes up in pain, has pain while they're sleeping. Those are the best to take because it takes a little bit of time to work, but it's going to last longer. Those patients that are in pain all the time tend to use 2 products, and sometimes 3. But the 2 products, talking about taking a capsule every day to help minimize the pain, and then have the tincture available, so when you need an additional effect of that CBD oil, you can use it then. Topicals can be used with the tinctures, can be used with the capsules, can be used alone. Again, I love the topicals if you have a localized pain, say a joint pain, a muscle pain. It does work on contact, but it's only going to last pretty much 1 to 2 to 3 hours, depending on your activity. So what's important is knowing what type of way to use it, if it's a tincture, a capsule, a topical, and specifically, not only when you use it, what dose to take. So again, to summarize, usually with pain, I would say about 25 to 40 milligrams, depending on the severity of symptoms, depending on the weight of the patient, as an initial dose. Some people do need an increase of a dose as you work with using CBD. Another way of, again, using a tincture is more for something that you need it more acutely, something that's going to need effect quickly, like a headache, a migraine, an anxiety attack, an acute pain. Some patients take it at night because they can't get to sleep at all, and they use it instead of taking a capsule, which helps them to get to sleep, but then it lasts all night. With a topical, really those are the best for people that just have localized pain, if it's a muscle, a joint. We have different topicals that work with different joints and muscles, depending on what type of symptoms you have. We have different topicals for small joints as compared to large joints, as compared to muscle pain. I think this right here is Pain Quench. It's a great product, great for small joints, great for muscle pain, actually very good with skin issues. We've had this is probably one of the first products we had, works really well. We have another topical. This is more like a BioFreeze. This is more for larger joints. This is better for muscle pain. It's nice because it's easy to just throw in your bag and just have it with you at all times. We have a third one, which is, it smells like spearmint. It has some salicylate in it, so people that are allergic to aspirin, we always ask, shouldn't use that. I've had one patient had an irritation of skin, but because it has some aspirin in it, it's great for small and large joints. It's great for muscle pain, and another type of carrying case. In terms of capsules, again, we have 10, 30, and 50 milligrams. For me, I would use a 30 milligram capsule. People that are over 250 pounds, we would use a 50 milligram capsule if you had to take it. So it depends on your symptoms, depends on the size of the patient, depends on how you need it, is very important. But most of my patients that are in chronic pain tend to have, I hate to have to say it, all three things. They have a capsule, which they take every day. Sometimes they take it one in the morning, one at night. They take the tincture when they need additional effect, and then they have the topical if it's more of a minor issue that would help them with supplementing their symptoms. Another important thing to understand is when you're taking it, it is important to know what type of product it is if you're somebody that is having drug testing at work. There's there's really 3 different types of CBD. There's a CBD isolate, there's a CBD broad spectrum, and there's a CBD full spectrum products. The product that's CBD full spectrum is the one that has a small amount of THC, which is less than 0.3%, which is allowed to be sold and bought without a medical marijuana license. Even that small amount of THC could show up on a drug test, so it's important. Patients that we talk to and discuss certain types of therapy, one of the first questions is, are you concerned about drug testing?